Welcome back to Africa Science Focus, the science and development show from SciDevNet. I am Ogechi Ekeanyo. Today we're looking at something that sits at the heart of life in the world, but rarely makes it into conversations about health, and that is plant health. We talk about human health, we talk about animal health, sometimes we talk about the ecosystem health. But plants are often forgotten, even though they feed us, protect ecosystems, shape disease patterns, and keep entire communities afloat. A recent paper, Worlds Apart, Plant Health and One Health and a Path to Equity, puts it very simply. One Health frameworks continue to overlook plant health, even though weak plant health systems can destabilize food security and widen inequality. So our reporter, Justice Baidu, decided to begin this story with someone who has spent years showing the world exactly why plant health matters. He is Solveig Danielsen, Senior Project Scientist at CABI, and lead author of the Worlds Apart paper, whose work focuses on bringing plant health into the center of One Health practice and research, the most basic question of all. What is plant health, and why should anyone care?
So plant health, depends on where you sit, how you understand plant health. So of course, it's a broad concept. But the reason why it is relevant for the One Health framework is that plant health is decisive for lots of things, for life, for food, for feed. It is decisive for the balance and the health of our ecosystems, for livelihoods, for nutrition, medicines, in all sorts of ways. Plants and plant health are an integral part of the health of other living beings, whether they are people or animals or microbes, wildlife. Yeah, so plants and plant health is an integral part of that complex.
Why is it such a key pillar when it comes to the One Health framework? And what happens if it is left out?
Well, as I just said, there are a number of areas where plants and plant health are decisive for assuring the health of other components. But one of the things that where we see limitations at the moment is in the way that One Health is normally understood. Because originally One Health was conceptualized around zoonotic diseases that affect, people and animals. But that, while that is a very important aspect of One Health, it is not enough. And by keeping a narrow focus on One Health, it limits the opportunities for creating synergies and impact that involve other sectors and topics as well. So if we don't consider these other things, including plant health, in One Health, we miss opportunities to create synergies and solve the very complex issues that this globe is facing.
Right. So how does plant health connect with that of humans and animals?
For example, through food security, feed security, the quality of the food. For example, the issue of mycotoxins in food and feed is an area that has a very high impact on the quality of food and feed and has severe health implications. There are a lot of chronic diseases related to high levels of mycotoxin exposure. So that is just one example. And there are other issues like if you look at the really big issues like pesticide use in crop production. So we're not only looking at the health of the plants themselves, but also the way that we produce food, and where, of course, pesticides are an important part of ensuring plant health, but that comes at a cost, because pesticides also have negative impact on people, environments, water sources, animals, wildlife, birds and bees, and everything. So there is a serious trade-off to be made when it comes to securing the food for people and animals in a world with a growing population, but also to make sure that it is balanced against the negative impacts. So those two examples are very clear.
Looking forward, how do you think what will be your recommendation in terms of changing the narrative and helping address the situation as we have now?
So one of the main major issues that we face in One Health, and it's something that has been talked about and acknowledged for years within One Health, is that the need to break down silos, institutional silos, disciplinary silos, because that basically prevents us from broadening the view on the major issues that we are facing. And of course, this doesn't happen by itself. There needs to be institutional reforms, but there needs to be incentives to change, because systems won't change unless there's something to push. And those incentives, they need to be both financial, there need to be policies that support more integrated approaches. We also need from the educational system to look more broadly and look for ways that things can be looked at in more holistic ways rather than by discipline and sectors. So I think that is kind of, you can say, the foundation of the issues, that we have a very fragmented and siloed way at looking at things. So when we then later try to deal with it, it becomes, piecemeal and often also project-based, it's hard to create real systemic lasting change when you have kind of a piecemeal approach to things, but you're still stuck within the same fragmented system.
Right. Thank you very much. And this will probably just be my last question, is if you look and from the work that you've done so far, why has plant health historically been neglected in this whole scheme of One Health conversations?
Yeah, that's a good question. And I think we need to go back to look at the origin of the One Health thinking, because it was very much focused on zoonotic diseases. It was people from the medical world and the veterinary world who developed the thinking and the concept around it. And then, when the idea took on and implementing started, research and implementing structures, they were designed around that original thinking. And the funding was also targeted that original thinking. So it becomes really hard later to break, when a concept is rooted in certain ideas. It's difficult later to insert something new elements, because it feels like disruptive and you already have a system that is focusing on one thing. So I think that's a big part of it, but also that you can say the professional worlds that work with plant ecosystems, plant health, they operate in their own world, in their own silos. So it means that these worlds, they don't often have any reason or opportunities to connect. So it's kind of a perpetuating kind of system where there's no real reasons or opportunities to break that or create a new conversation that could lead to a broader understanding of what One Health is and should be.
Well, is there anything else you might want to talk about that I have not asked you?
I would like to say that I do see change happening, and I do see an increased interest and awareness that One Health needs to be broader. I see that FAO is increasingly taking on that conversation. The IPPC, which is the International Plant Protection Convention, are also taking this on board. So what we need to do is make it more tangible, showing real life examples of what it means in practice, so that it doesn't just become words, but some words that are translated into action. But I see a change, and I see a willingness in taking this on. So this is the processes that we need to support in all the ways we can.
Next, we turn to Michael Osae from the Ghana Atomic Energy Commission. His research focuses on biologically safer ways to control pests and reduce crop losses using methods that minimize harm to the ecosystem. Dr. Osae shared his work on developing safer plant-based insecticides and pesticides, focusing on solutions that not only control pests, but also support sustainable agriculture and overall ecosystem health. Here's what he had to say.
My research has been mainly focused on exploring the possibilities of developing integrated pest management systems for key pests of economic importance. The IPM tools that I have worked on include a sterile insect technique, the use of botanicals, that is plant-based insecticides, the use of microbial pesticides, so pesticides that are derived from microbes like Bacillus thuringiensis, and then the fungi like Metarhizium and Beauveria. Now, in doing all this, my focus has been on how do we develop environmentally friendly pest control strategies that would have minimal impact on people, animals, and then their shared environment. So that is what has drawn me into the One Health space, looking at how do we reduce the amount of insecticides we throw into the environment because they affect biodiversity. They will affect natural enemies. They will affect beneficial insects like pollinators and other stuff. And then they also have adverse effect on the humans that apply this. Residues on our food would have effect on our health. So I have been in that space for quite some time now. I've been working closely with the PPRSG and EPA to identify how we can prioritize, we call them biologically or more like biologically friendly insecticides.
Interesting. So I want you to break this down for me. So say I'm just an ordinary person on the streets of Accra or just the countryside town in Ghana. How does issues like pesticides, crop diseases, and soil degradation, for example, spill into human or animal health? Why should I be concerned?
We should be concerned because so insects, they say, are our major enemies. They are in all our species. They eat our food. They transmit diseases to us. They destroy our infrastructure in terms of termites and other things. So we always are looking for how to control them. Now, in controlling them, the earlier technologies have been, apart from the indigenous knowledge that we had using botanicals and other things, insecticides were introduced, which are synthetic chemicals that have effect on these insects. The unfortunate thing is that apart from killing insects, they also have adverse effect on humans. So if we are applying insecticides on crops that we eat, and there will be residues on it, then those residues would definitely get into our food system, and that can affect us. Some of them have carcinogenic effects, so they can lead to long-term, in the long run, can lead to cancers. And in severe cases, you can even have food poisoning because there are insecticide residues on the food, and that can affect us. When it comes to the insects themselves, they transmit diseases to us. They eat our food, so then there's that interlink between insects and our health, because even the food we eat, having adequate food and nutritious food is related to health anyway. And some of the insects like the weevils, if they get into your grains, they eat the nutritious parts, which is the germ, and leave out the other parts for you, which is not nutritious. So if you eat insect-infested grains, chances that they have taken a lot of the nutrients from the grains is high. So that is one side of it.
My next question comes about why it hasn't, at least in the Ghanaian context, received the sort of needed attention, if you like. There seems to be a sort of neglect, even within the science subjects that are generally discussed in our space in Ghana. From your perspective and speaking from the context of a Ghanaian academic, what's the problem?
Basically, it's because we work in silos. So the people in agriculture are focused on their agriculture. They're looking at how to increase productivity. They're looking at how to control pests. So anything that would help us to control the pest and increase our productivity, we are fine with it, irrespective of what adverse effect it is causing in other areas. The people in public health think that, of course, the insecticides that are meant for public health are meant for us. So we only have to use them. forgetting that they were first being used for agricultural pests before we found use for them in public health. So then we're working in silos. We're not talking to each other. The environmentalists are not talking to the agriculturalists. The public health people are not talking to them and all that. Aside that, there hasn't been any real policy on One Health in Ghana. The one that was being developed it was being spearheaded by NADMO, a policy on One Health. I don't know if it has been passed now, but then there was a draft policy which I have cited, but I'm not sure if that has been passed now. Somehow that tried to bring together all the stakeholders. But then when I cited the draft policy, one of the areas I found clearly lacking was the area of agriculture, how agriculture fits into the One Health conversation. And of course, that has been the same across the world, because One Health concept started more between veterinarians and the medics or the human health people. So it has been overly focused on how zoonotic diseases are transmitted, or how diseases move from humans to animals or animals to humans. But then we are now bringing in all these other areas that are linked to agriculture. For example, antibiotic resistance. We use a lot of antibiotics in animal production. So we give them antibiotics, we inject them, and sometimes we feed it to them. Not all of it is used up in their system. It ends up in their waste, and this waste gets into the environment, can result in buildup of resistance and certain microbes and other things. So we are beginning to bring this kind of conversation into the One Health space. The use of insecticides, it leaves residues on the food, and the food gets into our food systems. It affects public health, pest management or vector control. It affects directly the people who are applying these insecticides. So all that is being brought now into the conversation. But the baseline is that even if the policy is being passed now, we haven't really engaged the key stakeholders or done enough public awareness creation for people to understand that these things really are what are involved in the One Health space. And even for us who are even working in the One Health space, we still are not talking to each other. So there are a lot of people who are working in the area of One Health in the country, but then you will go somewhere and then you hear about somebody doing the same thing that you are doing somewhere. So
that then takes me to the next question, which is what should change looking ahead? What do you think should change in order that we are able to properly integrate One Health policies into our national architecture?
So what should change is the first thing must start with policy. So the draft policy, we must look at it and quickly move it out to become a full-blown national policy. Then we have to do a lot of awareness creation. We need to put together something like a task force or a working group that would work in the area of One Health, bring all the key players, we call it community of practice. So all the people who are working in the area of One Health, either you are a medic, you are a veterinarian, or you are an agriculturalist or environmentalist, we all come together, even the public socioeconomists and all of those people who are in that space, we all come together and share ideas, cross-fertilization of ideas, we share ideas. We have a national agenda towards making sure that we mainstream One Health into all the things that we do. That is what needs to change. And until we are able to do that and get these things in the mainstream conversations, probably even incorporate it into our national curriculum, so that at a school level, we'll begin to teach One Health and let them know that agriculture is not independent of public health. It's not independent of environmental science. If our students begin to know that before they grow up, then they will be better decision makers than us.
In terms of filling the gaps, what should donors who are supporting the space, what should they prioritize if plant health is to be strengthened, especially?
So to prioritize plant health, one, it requires funding. We need to put in more funding into the area of One Health or plant health, because if you look at the funding that goes into public health, into communicable diseases, and into other areas, compared to what goes into plant health, what goes into plant health is woefully inadequate. Meanwhile, the efforts of developing environmentally friendly insecticides, the efforts of breeding varieties that are resistant to certain pests and diseases so that we will not use more insecticides in the field, And then generally developing integrated pest management strategies are expensive and they require money. So there must be more funding to support One Health.
Right. So from your experience, are there anywhere else, maybe not in Ghana, that plant health, the way that it should be has really worked, that you can speak about, or you think as a country we should and can learn from?
I was part of a project called Accelerating Impact of CGIAR Climate Research, ICRA. As part of the ICRA project, I was working together with another partner, mainly in the One Health area. And we coordinated all the activities of the project. The main thing was to introduce climate smart agriculture to the farmers. But once we were doing this, we focused on how do we make those climate smart agriculture strategies One Health sensitive. One Health sensitive in the sense that they are not having any adverse effects on the environment. They are not having any adverse effects on humans. So we did a nationwide survey, collected samples from all the sites where we were doing this work, and then we assessed certain One Health indicators like agrochemical residues. So we looked at pesticides, we looked at weedicide residues and all that. We collected data on food baskets. So the kind of foods that are within those communities, we collected data on them. We collected samples and we analyzed the levels of all these agrochemicals in them. We also looked at antimicrobial resistant genes in the samples that we collected. And then we also looked at mycotoxins. So there are some fungal spores that grow on our food. And they don't only grow on the food, they also produce toxins. And some of these toxins can get into our food system. I'm sure you have heard about aflatoxin, for example, and the ochratoxins. So we look out for all those in the samples. All we did was to use that as a baseline. And then going forward, we'll have to be monitoring these indicators and see whether the areas where we are introducing the climate smart One Health agriculture, the levels of these things are decreasing or increasing. That is one area where it has worked well. We did a nationwide survey to evaluate the impact of this project. And the feedback that we got from the farmers was that they were getting good yields and they were getting the returns on their investment and all that. And at the same time, they were not applying the very noxious chemicals in the field again. So that also will translate into health benefits for them.
And finally, to understand how these scientific and agricultural issues connect back to real policy decisions and public health outcomes, we turn to someone who sits at the intersection of all these systems. Kiki-Ope Oluwarore. She's the Executive Director of the One Health and Development Initiative. Her work spans human, animal, plant, and ecosystem health across West Africa. And she's one of the voices pushing to make One Health more than just a concept, but a practical framework that governments and communities can use. Kiki-Ope shows us why One Health matters, especially from a field perspective, and how the gaps we see today directly affect food security, disease patterns, and long-term public health.
I'm going to give maybe 3 concrete examples. Number 1, One Health means that if you have a dog, you are keeping a dog in your home, you should vaccinate that dog, because if you don't vaccinate that dog can come up with diseases that can be spread to you as a human being. A good example is rabies. Rabies is a disease that is mostly transmitted by dogs, and it has a 99%. Anybody who is infected has a 99% chance of, I don't know if that's the chance, but it's a 99% fatality rate, meaning the person is most likely going to die if you don't get urgent pre-exposure, post-exposure prophylaxis, which has been happening very well in our country and even including Lagos. So if you treat your animals, if you give it the right treatment, if you give it vaccination, if you give it the prevent diseases, you're also protecting yourself as a human being, because those diseases will not be transmitted to you. If, for example, you are taking care of your bird on your farm, and you are having the right, preventive measures for biosecurity, a poultry farm, for example, if your poultry farm catches, is infected with avian influenza, that can also be spread to you as a person, because it can be transmitted from animals to humans, and then the person also comes out with influenza virus. If, for example, you are going, you are dumping waste in a place that's, indiscriminate dumping of refuse, you are creating and breeding, you are creating a breeding ground for mosquitoes, breeding ground for mosquitoes that transmit malaria. You are creating a breeding ground for rats that transmit Lassa fever. Lassa fever also has a high fatality mortality rate in Nigeria. So we are seeing, so the examples I'm giving are seeing how from animals to humans, from environment to animals to humans, from environment to animals, how all these things are connected. The last example I'll give is, if, for example, you keep you say you want to, let's say, you want to go into the wild, you want to hunt, and you keep destroying we keep indiscriminately destroying our forests, our green areas, our ecosystem. We are increasing we are first of all destroying the ecosystem balance, where we need the wild, and we have a lot of green that helps to mitigate climate change. We are destroying that. We are also destroying having more interaction with wild animals, whereas they can be able to spread many of these diseases that are just kept in the wild that they do not show symptoms to. But when it jumps to human beings, we many times it affects us as human beings, and we come down with such diseases. Examples of such diseases that we have seen that has jumped from animals to humans, disease like Ebola, disease like Mpox, monkeypox. So these are things that, have one very, very day-to-day One Health importance to the layman, and which we have seen has been happening over time, and which is why we need to address this, the One Health approach.
Right. It means then that our we are all interconnected in some ways.
Absolutely. That's exactly the lesson.
Kiki Okwe spoke about how One Health can be better communicated at the community level and the practical steps needed to close the awareness gap.
While we have a lot of, we have quite some work going on at the national level, at the federal level in many West African countries, but at the communities, that is where everything starts and ends with, we still don't have as much awareness of this here. So that's, for me, will be the big gap. Disseminating all the wonderful work that is being done at the national level and bringing it out to the layman at the community, so they can be able to understand practically the essence of One Health in their everyday life.
How do we then close these gaps, and where do you think we should start from?
In closing the gap, the first thing would be the part of awareness. Awareness is the very first thing to closing any gap. Because if people don't know, they cannot act. If people don't know, they cannot change their behaviors, they cannot change how they think or how they, So we need that awareness to be driven from at every level, national, community, local government, as we are doing several health programs like the one we are doing with malaria, with this and with that, with, all these interventions. We need to start integrating the messaging of One Health into all these health programs. We need to start integrating the message of One Health even in agricultural programs, even in environmental health programs, in animal health programs, in livelihoods programs, because One Health is such a powerful, it has such a very important ripple effect on almost every sector of society. It goes beyond just health. It also impacts things like socioeconomic development and livelihoods. Because imagine if there is an outbreak that is, affecting humans and animals at the same time. Africans depend a lot on animals for livelihoods and also for food security and nutrition. And then human beings, of course, if a human is sick, we are having issues with productivity and being able to, live a productive life, or even, death, loss of valuable human resource. So all of these things are things that, we can create awareness on. Just depends on adapting the right messaging, depending on the person you are talking to. For example, how you will talk to a farmer will be different from how you talk to a fisherman, or will be different from how you talk to, let's say, a hunter or be different from how you talk to a market woman, depending on, what they do, and also depending on the kind of program that you're integrating it into. So, and the beauty of it is that One Health is very adaptable because it touches various aspects of our lives, and we can be able to see the impact across board when we are providing these messages. So awareness, number one. Number two will be the part of also policy. We need policy, and I'll put these two together: policy and budgets. So we are getting, again, compared to maybe the last decade to now, there was nothing about One Health plans or One Health strategies or One Health, or disciplines coming together to be able to decide how they want to implement One Health in their country and work together as collaborators. I think legal frameworks and policies are very important because, whatever we are doing it as a country or as countries, it's guided by the existing laws and legal frameworks and policies and SOPs that the countries have set. So if you can have this, if you can have this set of, many countries already have One Health strategic plans, for example, but how many are really implementing it? So that's something that needs to be really, really attended to. Then number three, which I'll consider like maybe the last very important one, will be the part of engaging stakeholders, and I mean stakeholders in terms of the professionals themselves that are involved. Again, awareness, capacity building. I think people need to be trained. People need to, like I said before, we all had our very wonderful training in universities, but we need to be able to understand that while we are trained in our specific fields, we have a larger impact across One Health. So we can have capacity building from university level. People can start including One Health in their curriculums. Like we are seeing that happening already. We can have training of professionals post-service, where they can be able to learn more about One Health and how to build their capacity and being able to respond to One Health issues. We can have training in specific areas like AMR, that is a One Health issue, like disease prevention, that is a One Health issue, on how people can better respond or better prevent diseases from spreading from animals or environments to humans, and even from spreading within the animal environmental sector. So capacity is also very, very important for this.
That's all from us at Africa Science Focus today. If you want to find out more, head on to the SciDevNet website. That's www.scidev.net. Today's show was produced by Lolo Cynthia, with editing by Titilope Fadari and Ogechi Kianyao, and reporting by Justice Spaidu. My name is Ogechi Kianyao. Goodbye.